Hit the subscribe button or visit us at auau.auanet.org.
The BULKAMID system is a minimally invasive treatment that has been shown to benefit women of all ages suffering from stress and mixed urinary incontinence. BULKAMID has a demonstrated efficacy of 80% when used as a primary procedure. It has a strong safety profile with no reports of gel migration, erosion or calcification. It has shown durability over time with efficacy rates maintained in 5 to 7 years. The technique consists on, through an urethral and a rotatable sheath, inject an hydrogel into the urethral mucosa to create cushions that must reach the midline of the lumen. Injections on different sites, always at the same plane, are repeated until the mucosal coaptation is achieved. The gel used at our hospital is a non-reabsorbable hydrophilic gel consisting of approximately 2.5% polyacrylamide and 97.5% non-pyrogenic water. The BULKAMID kit consists of a 0-degree urethral of 11 cm long, 2 hydrogel syringes, 2 12 cm needles, and a rotatable sheath. To assemble the BULKAMID system, start clicking the optic onto the rotatable sheath. This has a movable part that can be rotated 360 degrees. Make sure that the blue and the red tabs on the rotatable sheath are closed and attached to the irrigation system via the sword tubes. To allow free movement of the sheath throughout the procedure, the irrigation tubes can be positioned at 6 o'clock. Remove the protective tip cap from the BULKAMID syringe. Then remove the protection sheath with the white rubber stopper from the needle. Prime the needle by advancing the syringe plugger until hydrogel appears at the tip. This completes the assembly of the BULKAMID system. Preoperatively, it is recommended to discard urinary infection and to use prophylactic antibiotic. Patient is set in lithotomy position. At our hospital, we generally perform these procedures under anesthetic sedation. The BULKAMID system is introduced into the urethra and the bladder is inspected. Open the blue inflow tap on the irrigation tubing and close the red outflow tap to allow 150 to 200 milliliters of water into the bladder. Adjust the camera so the 12 o'clock position in the screen corresponds to the 12 o'clock position of the needle in the sheath. The needle is extended into the bladder until the 2 cm mark on the needle is visible. The tip of the rotatable sheath is then positioned at the bladder neck and rotated to the first injection site at 5 o'clock position. The entire BULKAMID system is retracted until the tip of the needle is in line with the bladder neck, taking care to maintain the position of the system. The needle is distally retracted into the sheath. Gently press the BULKAMID system parallel against the urethra wall till mucosa appears in front of the needle tip. The needle is advanced into the tissue parallel to the urethra wall until the 1 cm mark is aligned with the tissue surface. BULKAMID hydrogel is injected into the proximal part of the urethra until the blood reaches the midline of the lumen. Then the needle is fully retracted into the sheath. Using the first injection site as a guide, the BULKAMID sheath is rotated to the 1 to 2 o'clock position. Hold the BULKAMID system in place, only rotating the sheath to the next location while maintaining the level of the system in the urethra in order to get the blebs at the same level to ensure an effective coaptation. The needle is advanced to the 1 cm mark and the hydrogel is injected until the urethral wall reaches the midline and touches the opposite cushion. We usually perform this procedure between 2 surgeons, so that one controls the urethral, the sheath and the needle, and the other one introduces the gel from the syringe, in order to avoid movement while pushing the gel through the needle. To avoid overfilling the bladder and causing discomfort to the patient, close the water inflow and open the outflow between injections. The first two injection sites can be clearly seen on the screen and dictated the plan for the next injections. After 2 injections, the needle is changed as 0.5 ml of the gel are used in each injection site. These steps are repeated at 10 to 11 o'clock and 7 to 8 o'clock positions, or in less sites if only 3 cushions are required to achieve mucosal coaptation. Once the urethral coaptation is completed, all injection sites will be visible on the same plane. During the procedure, some troubles may occur. Sometimes the bleb may explode once formed, probably because it was injected too superficial or the tissue was weak. Consequent hematuria may blur visibility and difficult the procedure. It is important that the patient is correctly relaxed during the procedure, otherwise it will be difficult to perform the surgery, like in this case of persistent cough that can even force to stop the technique. If water inflow is weak or there are some leaks, the urethra may not dilate enough, making it difficult to see for injections. Use an adequate irrigation system and ensure that the rotatable sieve is correctly attached to the BULKAMID urethroscope to avoid these problems. After the procedure, the patient should be monitored until the first normal voiding. Only in the case of urinary retention, we use a pediatric catheter. Patients may resume normal work and daily activities within 24 hours of the procedure. We routinely perform intraoral ultrasound 1 month after the procedure to see the size of the blebs and their position. We obtain a clearer image of the blebs with transperineal ultrasound than vaginally. On patients who remain incontinent after the procedure, we used to see blebs on bladder neck and at the same level. Different levels may explain the failure of the technique. Also, we check blebs movement during cough or Valsalva maneuver, and its relation with other materials from previous surgeries, like this patient who had previous transbudator tape, retropubical tape, and now bulking agent surgery.